Hello and welcome to Checking the Vitals, a podcast powered by SpecialtyCare. I'm Todd Schlosser, and joining me today is Dr. Feyma, the Medical Director for Neurology at Gillette Children's Hospital here in St. Paul. I'd like to start off with this question. So what was it that drew you to neurology as a field?
I was initially very interested in child psychiatry. And
for me, child psychiatry seemed a very interesting way to help people live better, more well-adjusted lives.
Right.
As I began to get more experience with it, it became clear that it's a discipline that held my interest, but neurology and some of the organic disease of the brain, more epilepsy, learning delay, some of the genetic issues that neurology looks at as well, was more interesting to me.
Yeah, and you treat here at Gillette Children's sort of complex medical issues. It's not just, scraped knees and, bumps and bruises. So I'd like to talk a little bit about what it takes to get that classification of complex medical issues. What classifies it as complex?
Yeah, I think as a pediatric physician, there are some who want to see, ear infections. I'm someone who likes to ruminate a bit, so I like seeing the neurologically complicated patients. And what that means is these are kids where kids may have epilepsy and seizures, but a lot of our kids also have sleep issues and developmental issues and other autonomic related body issues that are related to the brain as well. I like the really complicated kids that make me think a lot. Yeah. And I'm happy to work in a place that actually gives me time to see them. Yeah. So.
Well, and I'd imagine because it's sort of complex and perhaps even compound issues, because one thing can lead to another thing, right? Yeah. Or one issue can lead to another issue, that it takes a while to maybe figure out what is the starting issue, what caused all of this to happen. Because I'd imagine you see, and correct me if I'm wrong, obviously, but you may see one thing and not realize that it's caused by a few other things. So if you treat that one thing, that may sort of unveil more of what the root cause is. Is that sort of the workflow? Or
I think that's a great way of putting it. I think that many of the children that we see, it's more about sort of kind of unwrapping what the root cause is. People don't always know how to ask the question about what the root cause is. They just know there's something unique, so they come to see us, and it's a really detailed and onerous kind of digging into what the issue is and where the root cause is. But yes, you could definitely, it's kind of the Russian nesting doll of kind of chasing things back to where's the actual kernel that we can kind of attack and fix here. Yeah.
So, and you mentioned that you guys sort of focus on more unique things, and I noticed a syndrome that I'd never seen before on the website at Gillette was Rhett Syndrome. Can you talk a little bit about what that is specifically?
Yeah, so Rhett Syndrome is a genetic condition. It's on the X chromosome. Females have XX, males have XY.
Right, and females are more likely to have Rhett Syndrome, correct?
Yeah. And I've been lucky enough to do some research here in that syndrome. It's quite variable, like anything. Most people are familiar with things like Down syndrome, where everybody knows somebody with Down syndrome, where some are very high functioning and go to college, some are very low functioning and will never drive a car or go to college. Rhett syndrome is probably a little bit more, the girls are more impacted, but they tend to have complicated medical issues, including epilepsy, sleep issues, movement disorder issues. I just saw one yesterday, one of our rural clinics down south. She was one of the more impacted girls. Already at age 3, she was in a wheelchair and needs a tube to feed. But we do see teenage girls who are walking and talking and can do quite a bit.
Since it is like Downs, and it's sort of one of those things that stays with you for the entirety of your life, what are the treatments? What can you do to help someone in those situations? Is it more about quality of life?
In some ways, I think that's a good way to put it. In many ways, a lot of what I do is sort of palliative in a way, because a lot of things I can't fix, right? So palliative is not a weak point. There's actually a lot of value in palliation and keeping kids in school and keeping kids out of the ER. But now is a very revolutionary time as far as a lot of the rare diseases like Rett syndrome, because there is more research being paid attention to there. And I could go very deep on this, but another example would be actually spinal muscular atrophy right now is a condition that a lot of child neurologists see as well. The kids get progressively weak, and the very severe cases pass away in infancy or teenage years, and now there's actually a drug to treat it. And we did some of the research here with that. It was an amazing trial, because by the end, some of these kids were very weak and couldn't even sit up. And by the end of the trial with treatments, they were starting to kick us and start to fight us, and it was amazing. And I think Rhett is next up on the docket for a lot of innovation. There's gene therapy coming down the pipe. There's other specific compounds that treat the root issue and not palliate.
To do gene therapy, is that using technologies like CRISPR to actually go in there and change the code?
So it's complicated right now. I think CRISPR is a very hot topic. I think it's still in its nascency as far as utility. I think some of the gene therapy right now is putting the genetic material that makes the deficient protein in, but it may not be like CRISPR style, like, excised and inserted.
Sure.
Sometimes it puts in little pieces of DNA that just kind of float in the cells and then make the right protein. The DNA makes the protein carries out the function, and the body is a very complicated mix of a lot of microscopic interactions and reactions that we just,
Yeah, I think most people don't realize how difficult it is to just make a normal person. Like the random events that have to happen perfectly to make someone who's healthy.
Yeah, development isn't this gene is needed this time, this gene is needed this time. It's more like kind of chords being played on a piano. You need this kind of set of 16 playing at this time or 16 playing at this time as a sequence, and it's complicated. Yeah.
So you mentioned that Gillette actually does some research as well. So, and what was it that you said you guys you had researched into that trial on? What was that specifically for?
The trial I mentioned was spinal muscular atrophy. We do some research I can speak to the neurologic perspective of research.
Sure.
We do more than I'm probably aware of.
Sure.
But we will do research into Rhett Syndrome, spinal muscular atrophy. We have a lot of research going on with movement disorders.
I did notice that you have the Gait and sort of movement center here. Yeah. And then I'd imagine just from the name is to either help people or diagnose people who have walking issues.
We have a truly sensational Gait Lab, which for a lot of our children we see with cerebral palsy and move uniquely, it analyzes them, and what it does is it proactively allows our surgeons to plan interventions. So they don't just operate blindly, they operate to know kind of where the tight muscles are, kind of what surgical interventions might guide optimal surgery.
So is it, and forgive me because I haven't seen the center yet, but is it you just watch them walk, and based upon how they walk and how they take their steps, their gait, if you will, you can analyze all of that, and then it tells the surgeon exactly what they need to know to go in and what they need to fix?
It's even more complicated than that, because we have motion capture software. There's points they put on the body. They actually will put sensors on the skin that actually measure muscle activation. And the floor itself is pressure sensitive, so it actually looks at their gait pattern. It's a very science-based way to look at gait and analyze it and break it down with the hopes that it yields a child that continues to keep their walking.
Yeah. So and that's to help people with cerebral palsy, obviously, but do you use it for scoliosis or anything that can also, because the spine can kind of impact walking? And
the fascinating thing about our Gait Lab is it looks at the whole patient. We do use it for a movement disorder clinic too, and so that's more focused on the upper extremities.
Sure.
The orthopods care about that, but they care more about the gait and everything dynamically. We will do things like have kids pick up small objects like raisins and things like that, and we have a whole protocol where we analyze that, because the Gait Lab helps us overall kind of plan interventions. But more importantly, know if what we did works too, because we do follow up and make sure it works.
Yeah, I was going to ask that. So when someone's post-surgery, you take them back to the Gait Lab and see how they're walking now, and maybe have to go back in and do more work, or maybe you decide that that's the best we can do, or is that sort of, it's used in that post?
Kind of used pre and post, and then the challenging thing with cerebral palsy is that it can change as kids grow. So when kids hit puberty and grow like a foot, the muscle tightnesses impact how they walk. Many of the textbooks will say that cerebral palsy is static, which is just not true. It changes, and so these kids need chronic care. Yeah.
And speaking of that, I mean, I'd imagine that a lot of the kids that come here for the entirety of their life, or for they come for 20 to 30 surgeries, or so you really get to know them as a patient. Do you also get to know sort of the families, and do you ever have the chance to sort of deal with them on an emotional level, or is it all clinical and you're sort of behind the OR door?
Yeah, I mean, the main thing that keeps me at Gillette is actually the families.
Oh, is it?
Because I think the families that we care for, the kids that we see, they're motivated, they want to work hard, they want to optimize, they want to be the best them they can be. We're happy to help with that. I say it to families every day, and I feel it every day truthfully in my soul, which is just we are not the most important people in this family's lives, it's the family. And so we are guest stars that kind of help facilitate things, but it's the families, they're motivated, they stick with the home programs, the school programs. It's just, it's a joy to take care of these families, and they are amazing. Yeah,
so you get to actually interact with them on a day-to-day basis, and I'd imagine you develop sort of almost like a working relationship with these families, because you're working with them and their children on maybe not a day-to-day basis, but a case-to-case basis.
It's a different kind of care. There are doctors that will see, a pneumonia, and then they're done. This is more chronic care. We get to know families very closely. It's hard. I think, it's very common topic in all of adult life now about burnout.
Yeah.
Burnout for teachers, burnout for doctors, burnout for a career du jour. But I think it's hard to be burnt out in a place where we continue to see these success stories that may never make the newspaper, but each one is exceptional.
Yeah. Well, I mean, I think that's important. It's not about the one that's going to make the newspaper. It's about the 30 that don't, but are making an impact in that one patient's life.
Right.
Because if you can impact someone, especially someone's child, you're not impacting just that child, you're impacting their parents and their grandparents and just sort of that whole community that's around those people.
Yeah, you're absolutely right. It is amazing to see how every patient that we see is essentially the tip of an iceberg. And I think, the part of the iceberg we don't see under the water is the grandmas and grandpas and the aunts and uncles and the therapists at home and the school teachers. And I mean, it just, every child we see is that tip of the iceberg. And we are helping advocate for kids with a massive network.
So do you think, and I'm just going to tie this back to something you said earlier, but you said your mom worked in special education and she kind of cared for those kids that, needed extra care. Do you think that's what it was that sort of drove you into this field and keeps you motivated in it?
Absolutely.
Yeah.
The kids that we see need an advocate and a personalized advocate. And not every patient I see gets the same treatment. And we have to listen to the family every time. We have to listen to the child every time. Their priorities might not be our priorities.
Right.
Took doctors a long time to realize that maybe we should ask families what they think, because for us a win is, being able to walk and stuff like that. But if the kid's main issue is it's my handwriting and I want to be able to write better at school, we're in a time now where I think we really have learned to listen better, which is kind of crazy that it took us that long to learn that.
Yeah, but that's very, very important now, and you can be an advocate for that.
Yeah.
So I'd imagine if you're coming in with your child who's, having these pervasive issues, you may run into other families that you see sort of often in this very specialized environment. So does that develop a community of families around the Gillette Children's Hospital?
Absolutely. The most amazing thing about the community we care for here is, not to get too detailed, but the cerebral palsy as a whole is about probably 3% of the population. And so, and the majority of cerebral palsy patients are very mildly impaired, but they're very medically complicated. There may be one or two in a community, in the cities where there's more people, there's more, but the parents often feel very isolated. So the parents with social media has been great. It helps connect people. When they physically come here, they often will mention that they feel like it's kind of home. There's other families that have the exact same sort of path that they're dealing with as well. You can't fully know what the path is like unless you're on the path.
Yeah.
And so I can counsel families, but I can't quite counsel them like other families can. And many families tell me they make connections here in the waiting room, on the wards, unfortunately after surgery, Ronald McDonald House.
Yeah.
We get along well with them. Or make connections in the Ronald McDonald House. It's just, there's a certain type of caring and coping I can't give, and there's community here that helps parents quite a bit too.
Yeah, I think that you can offer a lot of help and a lot of comfort, but there's a lot of comfort that can be given from someone else who's actually in the same position as a mother or father who's got a child with that issue, right? Yeah. So having that sense of community of people who they may see as peers, giving them support, I think goes a long way.
The challenge too is, as many know, I also have a daughter with special needs, so I spend a lot of my time in the community. Caring for my own daughter, and we just finished, her school evaluations and everything like that. And she also comes here for care. So many of the families I care for know that. I don't like to trot out my poor daughter because my path is different than everybody's path.
Yeah.
My child's not in a wheelchair. My child's not G-tube fed, but she's doing quite well. But I think a lot of parents have spread that about me. They know that, and I think it gives a different level of trust because I kind of am walking the walk as well.
Yeah. I only say this because you've been doing this, actually practicing for 10 years here at Gillette. And I imagine you have people who come to you and see you as sort of an industry expert in this area. So what advice do you give people who want to treat sort of complex medical issues?
My advice to somebody who wants to get into this field would be, quite simply, volunteer, get some experience, get some exposure. It's very easy to become enamored of what the job might be, but you need to see what the job is. And I think, I made the right decision to be a doctor. I love being a doctor. There are parts of being a doctor I don't love. I think that's part of any job.
Yeah.
So I think exposure, experience, and if you're passionate and you think it's for you, then keep your eyes on the things that keep you passionate, and understand you'll have to accept some of the other stuff.
Yeah. Well, thank you so much for joining us here on Checking the Vitals, Dr. Feyma. I really appreciate it.
Thank you much.